Hi, tonight we're talking about the importance of early detection and access to care. We're all nervous when it comes to the fact that what we should screen for and check for, and I think around COVID we've suddenly been aware of all the big scary things out there in medicine. So I'm a great believer on screening. Screening is about early detection. So it's not easy to screen because it makes people anxious. What do we want to do? You want to examine your breast once a month. You want to go for your mammograms and ultrasounds. And remember, screening is about health economics. So certain insurers will have certain criteria about how often you can screen. It's all about funding and foundations. That doesn't mean to say that every time you don't have a symptom or a concern, you should be able to access good health care. So why do we screen? We screen to pick up small cancers in the breast, particularly early. The other things we screen for, but this is not for this time right now to discuss. So once we have picked up something small, or you have a symptom and we find something, we need to make a diagnosis. And the way we make a diagnosis around breast cancer is with something called radiological guided, which means we use the mammogram and the ultrasound to guide us to do something called a core needle biopsy. It's not about the surgeon picking up a big scalpel and finding out what it is. I'm very interested in the concept of everyone having access to decent health care. So whether you're in government or private, you can access good multidisciplinary units. And before you start any treatment, you must have that discussion around every aspect of multidisciplinary breast cancer oncology care. So not all cancers do we start with an operation. Some we start with medical oncology treatment first. So by screening early, you pick up things early and you can treat whatever the type of cancer, the biological type, because we look at that today, even more importantly than how big is it and where is it sitting. And we use that as a how to treat guideline, which is discussed in a multidisciplinary environment with many doctors from many specialists. This protects you, the patient, because it means that there are many heads coming together to make sure that you are getting best care. I like independent multidisciplinary. So in my units, the doctors are coming from different hospitals, they're coming from different backgrounds. It's not about a tea party of I know you, or I play golf with you, or I am friends with you and therefore I send only to you. So I want to stress to people, take responsibility for your own health and your own body. Screen. If someone picks up something early, take time before you rush into all your needle biopsies. In fact, we're writing an article at the moment on the concept of radiology 2 and how you must take time, have a look at the results, work out where you get the biopsy, what the cost of the biopsy is. Once you know that it is breast cancer, make sure you treat it in a multidisciplinary environment, keep control of your own results, your own radiology, so that you are mobile. Make sure you are navigated by a navigator who's looking after your interests and using that person as part of your team when you deal with the doctors who are in your treating team. Don't be scared to go for other opinions. Don't be scared to get information around all aspects of your care at any stage.